Good day, everyone. Welcome to the International Conference on Global Education 2025. My name is Salman Al Zahrani, and my ID number is 011-230-723390. Today, I'm going to be talking about the association between self-efficacy and resilience in nursing, which is a systematic review. These are my contents. I will be going through introduction, problem statements, objectives, literature review, research methodology, results, discussion, and finally the conclusion. To adapt to the challenges of daily life and appropriately respond to all situations, nurses need to have a strong sense of perceived resilience and self-efficacy. The study assessed the relationship between self-efficacy and job resilience. The review will compile findings from peer-reviewed research assessing the relationship between self-efficacy and job resilience among nurses. Nurses work under intense pressure conditions comprising of limited staff, time constraint, ethical dilemmas, and emotional exposure. These difficulties highlight the necessity of identifying and improving organizational and human resources that might support nurses in the face of hardship. Understanding how self-efficacy influence resilience can actually help to establish supportive workplace culture that empower nurses and lessens occupational stress. In terms of my objectives, general objective is to conduct a systematic review evaluating the association between self-efficacy and job resilience in nursing, specifically to evaluate and synthesize empirical studies that assess self-efficacy and job resilience in nursing population. Also to assess the strength and direction of the association between self-efficacy and resilience. Also to establish contextual and methodological factors that impact the association. Some studies have elaborated that self-efficacy and resilience are significantly independent as they have the likelihood to supplement and reinforce each other mutually. According to Bawazir et al. 2025, resilience can be improved through the development of self-efficacy. The association between the two is significant in nursing due to the nature of clinical work. As a nurse with a strong efficacy is likely to feel more competent and in control even in emotionally or chaotic surroundings. Various studies have shown moderate to strong association between the two skills, while others have established more multiple content dependent association. These are my research methodology. I conducted research through databases like PubMed, Google Scholar, Scopus, Science Direct for papers that were published between 2015 and 2025. I also utilized the manual data search to locate other studies satisfying the eligibility requirements. These are my inclusion and exclusion criteria. In terms of research methodology, the topic synthesis involves 3 stages. The researcher coded written texts line by line as part of the initial stage. During the assessments, free codes were organized to offer descriptive themes. A coding guide were created to guarantee a methodological approach to data coding. Publication published in peer-reviewed journals and conference proceeding were used to reduce selection bias. And also a critical appraisal skills program technique was used to assess the article's benefits and drawbacks. As can be seen from the diagram, the results of for the Prisma 2020 showing the selection criteria of the studies that were eliminated and the study that was included in the review. The researcher carefully compiled a list of three main topics after reading the papers in the analysis. First of all is the self-efficacy and job resilience in nursing population. Secondly, the strength and direction of the association between self-efficacy and resilience. And thirdly, the contextual and methodological factors that may impact the association. FIDA et al. 2018 established the protective impact of relational occupational coping self-efficacy against later burnout, turnover intentions, mental health, and incivility. The study concluded that relational occupational coping self-efficacy is a significant protective factor against adverse work behaviors. Also, another study by Ozdemir and Kaplan 2024 established a significant positive association between job fulfillment levels, age, psychological resilience, total years of services, and general self-efficacy. The study concluded that managers can significantly elevate psychological resilience, self-efficacy, and job fulfillment levels by creating strategies for effective factors. Lai et al. 2023 established that there was a positive correlation between general self-efficacy and multiple dimensions of psychological resilience among nurses. Another study by Muhammad et al. 2023 established that self-efficacy links the association between authentic leaderships and nurses' resilience. Self-efficacy accounted for 49.3% of variability in nurses' resilience, which is essential in promoting resilience via leadership practices. Various demographic variables such as age and years of experience can significantly be influenced by self-efficacy and resilience. The more experienced nurses that are more likely to develop self-efficacy via repeated exposure to different clinical situations, which boost their resilience. Nurses' perceptions and their effectiveness and capacity for independent action and clinical context may be influenced by cultural values. Most of the studies were cross-sectional, which may restrict casual interferences and introduce response bias. In conclusion, this review evaluated the association between self-efficacy and job resilience among nurses by evaluating key studies published after 2015. The result proved that self-efficacy is positively affecting nurses' ability to navigate occupational stress and reduce burnout and ensure long-term professional commitment. The study utilized enumerated and a positive correlation between self-efficacy and resilience among nurses. Strong correlation coefficients were highlighted by quantitative data such as those published by Lee et al. 2023, confirming statistically significant and robust association. The finding emphasized the importance of self-efficacy in buffering against the psychological difficulties in nursing. And the recommendation from the study, there was various recommendations that included. Firstly, nurses manager must design and execute training initiatives that establish self-efficacy via skills growth, stimulated scenarios, and confidence-building exercises. Healthcare institutions should encourage a culture of cooperation, acknowledgement, and psychological safety where bosses and co-workers support nurses. Transformational and authentic leadership styles that empower employees, increase autonomy, and foster trust should be emphasized in nurse leadership training. And finally, contextual and demographical factors, including years of experience, cultural background, and clinical setting, should be considered in interventions that are meant to increase resilience and self-efficacy. And these are my references, and thanks for your time.